Today on Corporate Review, join us as we explore innovative technologies, cutting-edge solutions, and timely discussions from leaders across the globe. This is Corporate Review.
Welcome to Corporate Review. I'm Jackie Bales. Growing concerns about infections acquired in hospitals and sexually transmitted diseases are driving the demand for disposable medical products made from rubber. The Malaysian Rubber Export Promotion Council is a nonprofit organization set up to undertake the promotion of Malaysian rubber products, including rubber medical devices. Director Dr. Isa Yip is here to tell us all about it. Welcome, Isa.
Well, thank you. It's nice to be here, and thank you for having me.
Isa, tell us more about the Malaysian Rubber Export Promotion Council.
Well, the Malaysian Rubber Export Promotion Council, or MREPC in short, is a non-profit organization, as you mentioned earlier, set up by the Malaysian government as well as the rubber product industry in Malaysia to promote Malaysia as the world-class exporter for rubber and rubber products. The council, part of its job is to highlight competitive advantages of Malaysians' production capability as well as the product's quality. Malaysia is currently the leading exporter for medical gloves, Foley catheters, and prophylactics. The mission of the council is therefore to facilitate and promote the export of rubber products, quality rubber products, and enhance market access, as well as to identify further market opportunities worldwide. And I also like to mention that for overseas facilities of MRPC, they also serve as the information or education center to update the users of the latest development in rubber products, as well as to help them to better understand the use of the products they're using.
Isa, what is the risk to medical practitioners who are using medical gloves that might be made out of a lower quality material, like plastics, for instance?
You see, in the use of medical gloves, one of the very critical criteria is barrier protection for the users to protect them against transmission of viruses and bacteria against dangerous infections. Many studies have shown that although there are many types of gloves available in the market, they have different barrier capabilities because of the materials they use are different. And studies have shown that the best material is still natural rubber latex, and the least is the plastic material like vinyl.
Wow.
Yes, and if you're using lower quality gloves with inferior barrier properties, you're exposing yourself to unwanted infections.
Absolutely. So tell me about Malaysian rubber. Why is that more reliable? Why is it better?
The Make in Malaysia quality rubber products are actually produced by experienced and reliable manufacturers, not to mention that the production is strongly supported technically by well-established research institutions in Malaysia, like the Rubber Research Institute, which is the biggest research institute in the world on a single crop, as well as a very well-established laboratory in United Kingdom. And the reliability and quality of Malaysian rubber products are very evident by the fact they are being used in more than 190 countries worldwide.
Wow. So which material then provides the most effective barrier performance in reality?
It is natural rubber latex. This is they always have very good performance. For example, they have very good durability. That's why the standard has a higher pressure required. And they have very good tactile sensitivity. Tactile sensitivity, when you wear the gloves, you should be able to feel the patients. A lot of synthetic gloves are not able to do so. And in the case of natural rubber latex gloves, they have one extraordinary property, is the resealing properties. When these gloves encounter very tiny needle hole puncture, the holes are able to seal up again. Really? This doesn't happen to all the synthetic gloves. In fact, if you have a small hole in the synthetic gloves, they just tear up. And also our latex gloves, natural rubber latex gloves, have very high puncture resistance and high tear resistance.
So Isa, how can the correct usage of medical gloves help save people's lives?
Well, if you use the right gloves and use them properly, you would help to reduce the people who get infected by, for example, hospital-acquired infection, the HAI, which the CDC has already reported that nearly about 2 million people get HAI every year,
Wow.
and about 90,000 people died from it annually. Glove is one measure of helping you to prevent that. So it will help to reduce that number.
What about the cost of these various types of gloves? Can you rank them as far as the cost and the
Yes.
low protein latex ones? I imagine those are probably the most expensive of all.
The price of latex gloves does vary depending on various factors. Well, so are the other gloves. But the cheapest gloves around in the marketplace are those of vinyl. They're very cheap, and that's why in early days especially, a lot of hospitals, they thought gloves are gloves. They didn't realize the difference, then they went for vinyl. And
Now we know.
the thing to do. And then you have nitrile gloves and latex gloves. The price vary. Nitrile gloves are supposed to be quite costly, more costly than latex, but then when the latex price went up, the raw material, then they became more competitive. So
Varies.
this is depends on the market force.
Interesting. So, but the bottom line, your advice to healthcare workers in general regarding medical gloves is?
If you are not allergic to latex proteins, then opt for low protein latex gloves. Studies shown that it is okay to use them. But if you are allergic, please avoid latex gloves and use non-latex gloves that really protect you. A very good option would be nitrile.
Okay. Well, Isa, it sure sounds like the Malaysian Rubber Export Promotion Council is helping to promote the use of high-quality Malaysian rubber products, and I'd like to thank you for joining me today.
You're welcome. Thank you.
For Corporate Review, I'm Jackie Bales. Thank you for watching.